Hi everyone, this is Neil Writer, also known as the Wax Whisperer. Thank you for joining me in my latest video. I have a couple of cases here for you today, and in both patients they had very dry, medially impacted earwax and dead skin, so keratin. And this is patient one. Patient one also had a tender entrance to the ear canal, which had caused them to rub it, and unfortunately it's made it a bit worse. So we had to be really gentle when we're inserting both the endoscope and the instrument into their ear, because we wanted to minimize any contact with the entrance of the ear canal. Usually the outer third of the ear canal, the cartilaginous portion, is our safe area. It's made of cartilage, it's flexible, it's got a thick layer of skin acting like a buffer. So it's normally the inner 2/3 of the ear canal that we're mainly concerned about in terms of making contact. But with this patient, we had to also be a bit more cautious than usual in terms of the outer third. So I'm trying to hold the endoscope in such a way where I'm not resting it against the canal wall. And normally that's what we would do. We would stretch the ear open with the endoscope and just place the endoscope against the side of the ear canal to keep it ajar, and also to rest the endoscope so it's nice and stable. Nonetheless, we're managing to remove this. I have referred the patient to their GP because there is a bit of visible inflammation at the entrance of the ear. I've recommended over-the-counter acetic acid spray in the meantime, but they probably need something a bit more stronger that has an anti-inflammatory effect, and there is a particular medication that can be prescribed by the GP in the UK. I'll just come back to that in a moment. You can see there's a little green sequin there. I'm not sure what it is. So this is some debris that's fallen into the ear. A bit of glitter sequin that's just gone in, and it's attached itself to the wax. And that's one of the functions of the wax. Any foreign bodies, particles, debris that may enter the ear that stick to the wax. Obviously there's a foreign object there, and particle that have entered the ear stick to the wax, and it's protecting the eardrum and also the canal wall. So we've managed to remove the debris from their right ear. So this is the patient's left ear, and in a moment I'm going to circle some cream that the patients tried to apply themselves because of the inflammation, and they've just used a cotton bud, which has unfortunately also pushed this debris further in, but a bit of cream got attached to the dry skin and wax. I'm just going to circle that in a moment so you can see it, well, although it's there on screen, quite visible. So yeah, in the UK, doctors can prescribe a kind of a more stronger version of acetic acid. This medication that they prescribe is called otolaryngology. It not only contains acetic acid, but it contains neomycin, which is an aminoglycoside. So it's an antibiotic, if you like, and it stops bacteria from reproducing. And in addition, it contains dexamethasone, which is a steroid, which has anti-inflammatory benefits. So that will hopefully help the patient. So we can see the eardrum there. They have got quite a narrow oval shape to it ear. Most of our ears are oval in shape. They're not round, cylindrical, they're more oval, whereby the height of the ear canal is greater than the width, so hence giving its egg shape, oval shape. I would say this patient's ear canal is slightly more egg-shaped than the norm. Using a fine end suction probe here, and this is the outer diameter is about I'm just trying to remember, about 1.4 mil or thereabouts, and it just about fits at the bottom of the ear canal, so there's not much wriggle room here. I'm just trying to lift this dead skin off the canal wall.